everyone, hope you're well. So it's dark and it's cold out there. And if you're like me, winter is the time where you just want to cuddle up at home and not go anywhere. If you're like that, then it may be difficult to think about having treatments, but a lot of people have said to me now is a good time to do all those treatments that they couldn't do in the summer because they were out and about visiting friends and unfortunately being exposed to the sun. So what are the good treatments to have during the winter, during this time when there's less UV around and you actually have some downtime or can afford to have some downtime? So these are the treatments such as microneedling and peels, and they can have different downtimes. Now, what I mean by downtime is a time that you possibly wouldn't want to be seen by people. So when you're red, when you're flaky, when it's obvious that you've had treatment. So let's look at the different treatments that are available and things that you might consider doing during the winter. Number one, as I said, is microneedling. So what is microneedling? Well, for a microneedling procedure, what we do is we numb the skin with numbing cream for about 30 minutes. Then we remove the numbing cream and then we run the skin pen, which is the device I use in clinic, and we run the skin pen over the different areas of the face. And what that does is that it introduces needles into the skin at different depths as we go all over the face, and those needle puncture marks are then healed in the skin. And when they get healed, collagen is laid down as the sort of beginning of the healing phase, and that increases the amount of collagen in the skin. So microneedling is amazing for those fine lines and wrinkles. It's great for any type of scars, even expression scars, so the skin scarring that you get from those very deep expression lines. It's great for uneven texture and uneven sort of rough surfaces. Great for big pores and for blackheads. So I really love microneedling for those kinds of treatments or for those kinds of conditions. And I would advocate that you are going to have about 2 days of downtime. So on the day of treatment, you will be very red. After the treatment, pink, absolutely pink, and it can feel a little bit scratchy. Then the next day you're a lighter pink, and the day after that you are almost back to normal. A lot of patients say that they have some flaking, so you may experience like a light dusting after your microneedling treatment. So those are things to expect with microneedling. The other things to bear in mind with microneedling is that I wouldn't wear makeup those days that you red. So I'm going to ask you to not wear your makeup and stop any of your active ingredients a couple of days, about 3 to 5 days beforehand, and then not to use them after the microneedling until the redness and the flaking has disappeared, and that's usually about 3 to 5 days after treatment. So that's sort of a little bit about microneedling. Of course, there's some contraindications and some side effects, and if you're interested in the treatment, do talk to me so I can go through those with you and make sure that you're a good candidate for microneedling. The other treatments that you may think about during the winter are peels. Now, peels come in sort of different depths. We can have superficial peels or we can have very deep peels. Superficial peels are the ones where you don't actually peel. So what I mean by that is that you might see microscopic dusting where you kind of go, it's a bit, but you don't actually shed in chunks. And most people, when they hear the word peel, they think they're going to shed in chunks. No, that is not going to happen with superficial peels. And the superficial peels that we have in clinic are peels like the neostrata glycolic peels, which range from 25% up to 70. You have to start low. You can't just jump to 70. You have to go up the gradients. We have to kind of get your skin used to it. The other superficial peels that I do, of course, the Abaji Radiance peel. I also do a retinal peel. And then I've got the Zeo stimulator peel, and that's also known as the red carpet peel. Now, these superficial peels are great for giving you a start if you're going to get going on a skincare regime. It really gives a great exfoliation, gets rid of those dead old skin cells that have been sitting on the skin for a long time. It encourages new skin to come to the surface. It helps with uneven texture. It helps with blackheads. It helps with really rough texture on the skin. So that's kind of, if you're wanting to improve that, get a nice glow, get radiance, that is where a superficial peel is going to help you. And you don't have to have skincare or sort of pre-treatment. So We'll talk about pre-treatment with deeper peels. These are the type of peels that you can have a once off, or you can do them regularly. You can do them up to once a month and, you know, really just rejuvenate that skin by getting a good shed of those dead skin cells, because we all know that you get better looking skin the quicker the cells turn over, and of course the less we have of those dead skin cells. So those are the superficial peels. Really great, very little downtime. Usually you may be pink on the day, have a little bit of like dandruffy kind of peeling over the next couple of days. I would, again, simple things like just avoiding makeup and making sure that you wear sunscreen if you are going to go out, just because we have exposed those underlying skin cells. And but the downtime really on that is a day or two, if not any. Then if we move on to the deeper peels are peels that actually go to a deeper level in the skin, and that is where you can see that excessive shedding, where you have shedding for about 5 days. And this is the type of shedding that you cannot pick and you cannot pull, because if you do that, you can expose the underlying skin too soon and you can risk causing scarring or pigmentation. Now, before you have a deep peel, I would advocate that you have, well, I wouldn't actually peel anyone who hasn't had pre-treatment with some form of skincare regime, because we need to get your skin healthy. There's no point putting on a deep peel or you know, a high quality acid onto the skin if it's not healthy, because it's going to react in different ways and not going to get you the result you're looking for. So I would pre-treat you with a skin care regime to make sure that your skin is at the optimum health, and that would be about 6 weeks worth of treatment, and then we can go into a deeper peel. Now, the deeper peels that I do in clinic include the Skin Tech TCA peel, which is trichloroacetic acid, and that is a 50% TCA. I also do the 3-step Zeo peel, and that is great for pigmentation, for really improving fine lines and wrinkles and texture, and that's a 10% TCA in combination with some other acids. So if you're looking for deeper peels, this is sort of where you want to be, but you do need to have a skincare regime in place before you attempt one of these peels, because of course there can be complications such as hyperpigmentation, hypopigmentation, or skin scarring. So I wouldn't advocate to have a deep peel if you haven't started a skincare regime, or you have a skincare regime that you're going to follow during this time. The downtime that you're looking at, roughly about 5 days, and it can be really bad. The flaking can be quite excessive, where you do lose a lot of tissue of the skin. You can't pull it to hurry it along, so you have to be super patient and really take care of the skin. You can cut off the little flakes with the tiny scissors, but no pulling, just resting, and there is quite a bit of downtime. But the results can be really, really effective, especially if you've got pigmentation issues such as melasma. So those are the options for you for peeling and for microneedling that can cause downtime and be an issue for you when you're out and about socializing, or in the summer months when UV rays are too high. And I wouldn't advocate it, because we're exposing new skin cells by taking off that top layer, and therefore it is just safer to do in the winter. So if you're interested in having some downtime, being a little bit red, but really getting some amazing treatments during these winter months, then do contact the clinic. Let me chat with you through some of the side effects, some of the contraindications. Let's look at your medical history to make sure you're a candidate for the peel that you're looking for. I can also talk you through which peel may get the best results for you, and which is the one that I would recommend for you, depending on what you're trying to achieve. So contact the clinic, let's get you booked in, let's get peeling, so we can see those amazing results for the skin and have amazing new skin for the new year.